Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is what you need to know about lumbar sympathetic blocks. What is a lumbar sympathetic block? It's a procedure used to relieve pain in lower extremities from several neurologic and vascular conditions. Sympathetic nerves emanate from the spine and regulate a lot of behind-the-scenes activities in our bodies, such as activating sweat glands, dilating blood vessels, the fight-or-flight phenomenon. It's called the autonomic nervous system. You can see it down here in the lower lumbar region around the aorta. It's a huge plexus of nerves, okay? You can see that there's ganglia, there's a sympathetic trunk, and it's a broad region. Who does well with a lumbar sympathetic block? Well, those who are suffering from RSD or CRPS, those are termed together reflex sympathetic dystrophy, complex regional pain syndrome. The phantom limb pain does well, post-herpetic neuralgia, shingles, cancer pain, pelvic pain, and those with non-operable peripheral vascular disease can receive immense relief. The procedure is performed with the patient laying on his or her stomach on an X-ray compatible table. Usually IV sedation is administered. It's not absolutely necessary. The pain doctor will go either unilateral or bilateral, and fluoroscopy, which is a real-time form of X-ray, is used. Once the needles are in position, the pain doctor usually will administer some dye to make sure that they're satisfied with where the needle is. And then for the procedure, numbing medicine plus or minus some steroids is administered. Phenol may be used, which is a derivative of alcohol, to give longer lasting effects. You can see here the needle is going around the spine to the area where the sympathetic trunk is, and numbing medicine is being given. You can do unilateral, or bilateral is usually better because then you can get both sides of the sympathetic chain. Are there risks? There's small risk: infection, nerve injury, bleeding, allergic reaction to the anesthesia. This is no different than with any injection. Unusually, you can get some drop lung or a temporary numbness. The drop lung is a big issue. Usually you have to get a chest tube for that to reinflate it. But right away, with a successful block, patients will notice an increased temperature in the leg and the veins feel full. This is normal. It means it was done correctly. A temperature increase of 2 degrees Celsius denotes a successful block. What are the outcomes? Well, a few studies have been done on this, but sympathetic blocks have been shown to be an excellent pain-relieving procedure for those suffering from RSD and CRPS. Oral opiates just typically don't do well with these conditions, so the blocks may be extremely effective. The top non-operative pain management in California is available with the affiliated pain clinics in the California Pain Network. There's multiple throughout the state, including San Diego, through OC, LA, all the way up to San Francisco and Sacramento. Over 50 insurances are accepted, with over 25 treatment options being available. The overall success rates exceed 90%. So visit us today online at californiapainnetwork.com and call us at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.